Before your presentation starts, I'd like to take a few moments to introduce you to the City of London Dental School. We're a private postgraduate dental school based in London and run from our college facility at Southgate. Here we offer a number of various programs, both short and degree programs. At present, we offer 6 MSc titles validated by the University of Bolton. These include clinical dentistry, orthodontics, periodontology, pulpal therapy and endodontics, restorative and aesthetic dentistry, and the specialist practice of restorative aesthetic dentistry combined with implantology. These are delivered from our state-of-the-art teaching facilities, and to be introduced shortly are 3 more new titles. We're also introducing the MSc in the specialist clinical practice of aesthetic non-surgical interventions. This is to do with facial cosmetics. The MSc in the specialist practice of computer-guided implantology. This is implantology taught from a digital perspective. Also a combined MSc of restorative aesthetic dentistry with implantology. These programs are all taught from our laboratories where hand-on experience is required, where delegates get the opportunity to use the latest digital equipment, printing materials, scanners, and also to practice prep techniques on phantoms. Our short programs are in topics such as implantology, restorative and orthodontics. These programs normally last anywhere between 4 to 12 months. We also offer clinical internships in the UK and the UAE, where delegates get to treat patients directly. In addition to this, we offer diploma and certificate programs. These programs are at HE level 7, so they're university certificates, which means that they can be used towards MSc programs, not just MSc programs that are offered by the City of London, but also other programs. So thank you for sparing the time to listen to this presentation. If you want any more information, then please contact us at info@cityoflondondentalschool.co.uk. I hope you enjoy your presentation today.
And it's a pleasure to be invited today and to participate, and thank you very much, Professor Stuart Harding. It's a joy. It's a joy. Facial aesthetics is a joy. It is not your standard dentistry. It's reversible. The treatments we do are all reversible. It's not like you put a burr to a tooth and really it's that downward spiral. Patients don't come in, they can't open their mouth, they got tongue like an elephant's trunk, they got saliva like the Niagara Falls, they don't like lying back, they get giddy, you can't get them numb, and then they don't want to pay you. This is completely the opposite. People will come in, they'll have their money and they'll go, treat me. And one of the tricks is when to say no. And that's what we'll be covering as well on the medico-legal aspect of it. If it's not going to be a joy, don't join us, because although it's work, it should be a pleasure for you as well. How many of you say this when you go to work? Or how many of you take one of those words out, the word to? So what is non-surgical facial aesthetics? Well, they're procedures and they involve products or techniques that affect the muscles and the skin of the face, and they produce a more relaxed, refreshed, and youthful appearance. They also have a dental functional aspect, for example, in bruxism and reducing gummy smiles. And they work synergistically with the treatments that we use to enhance the aesthetics of the teeth, for example, whitening or straightening. The market is burgeoning and we can see this from the International Medical Travel Journal referencing Lang & Berson, which is a very well-known and respected healthcare intelligence, and they estimate that suggesting that the market, non-surgical market, will be worth in excess of £3 billion within the next 5 years. And that was in December 2018. In aesthetics today, dentistry today, again in 2018, they were saying the aesthetic medicine market to boom over the next 6 years. And we can see this from the global medical aesthetics industry, the market analysis and forecast that non-invasive procedures generate approximately £16.7 billion per annum, and they'll grow at a compound annual growth rate of about 4.5% over the coming 5 years. And again, that was in 2018. And although we're not in the EU now, we're very high up. We're still obviously say we are at the moment, but we're second in position behind the US for delivering these treatments. And facial aesthetics complements aesthetic dentistry perfectly. We create the perfect smile. So why wouldn't your patients want a beautiful frame to enhance it? And why? Why do people have this? What's the catch for people to come in and have the treatment? Well, in this mad world in which we live in, people want to look appropriately younger. They want to look different. They want to feel better. And I want to say to you, it's not just about being a page 3 model, whether you're a female or a male. As patients I've had, a lady came in, she was recovering from cancer, little cuddle, few tears, did the treatment. Another lady came in, crying her eyes out, hated the way she looked. She came in with her son, little cuddle, few tears, did the treatment. And I had another lady who came in, whose son had been murdered some years previously. Oh yes, and there was one lovely elderly lady who came in, and I did the most tiny bit of treatment, and she turned around to me and she said, "You've made an old lady happy." So there's a lot of psychological aspects and feeling better about oneself in these treatments. And people come in to regain, refresh, change an unloved feature, and as we've just mentioned, response to adversity. So facial wrinkles and lines, the causes, well, that horrible word, aging, I'd rather call it maturing, becoming wiser, owling I call it, genetic makeup, environmental pollution, chemical substances, disease, lifestyle, and sun. Sun. So you can understand what I'm saying about the sun here. And what causes us to age? Well, muscle activity, loss of volume, our bone and cartilage remodel, gravity. Do you know if we all walked on our heads, we'd look a lot younger, and sun damage. Now, 80 to 90% of aging is caused by extrinsic factors. Now, although I can't see you, I want you to put your hands up. I'll use the word guilty, but it's not really guilty. How many of you are guilty of 4 of those? How many are guilty of 3 of those? How many are guilty of 2 of those? How many are guilty of 1 of those? And how many people need to get a life? Well, I put my hand up for 3. I don't smoke, but I must admit, previously guilty of 3 of those. So why do people come in to see us? Well, the 3 key features that bother our patients most: sagging, atrophy, and wrinkles. And it's very important to distinguish these because the treatment solutions can be very different.
As I mentioned previously,
sagging results from a loss of elasticity in the skin, and that comes with age and can really only be corrected by surgery.
where that's like.
Now there is a newish, quite a new treatment now called threading, where you can lift the skin with these resorbable threads, but it's not permanent. It does need repeating. So usually sagging is surgery. Atrophy. Now this is a result of loss of fat and muscle in the face, and we can look after this with injections. We use synthetic fillers. And then there's superficial wrinkles, and they're likely to be caused by sun exposure, can be treated, for example, by chemical peels, microneedling, or lasers. We'll mention those a little bit later on. And then the deeper wrinkles are caused due to facial expressions, mimetic movements, contraction of facial muscles, and we usually treat this with botulinum toxin. Stuart, I've got, I don't know if you can hear me there, but I've got a little box about C waiting room. I wonder if you could move that or get rid of that for me, because it's on in the just blocking up some of my screen. So it's a black box with C waiting room on it. So if you could just remove that, that would be great. Thank you. So this chap here, or lady, I don't think there's much we could do with that sagging apart from a good old hug and a good old stroke. So how do we combat the aging process? I like to put things in compartments, and this is a very simplistic way of dividing up facial aesthetics. So there's relax, and that is reducing muscle hyperactivity, and for that we use botulinum toxin. Filling, we can optimize facial recontouring, and we use dermal fillers. Volumizing, we can provide volume replacement, and again we use dermal fillers. And then revitalization, where we revitalize the skin, not only includes some of the dermal fillers, but everything else out there. So revitalization actually has got the widest scope of treatments. The treatments that we most do or are most done in the world actually are the first, relaxing with botulinum toxin. So the results of treatment need to be natural and discreet. We aim to achieve a comprehensive, harmonious facial balance. And understanding the anatomy and the anatomy of aging as well, and of the muscles and the skin, by doing that, we can achieve better and successful aesthetic treatments. And unless we understand the structure of the human body and how it changes, we won't be able to do this. People ask, is it safe? Well, when provided by an appropriately trained and qualified clinician and injected in an appropriate medical setting, botulinum toxin and temporary dermal filler treatments are extremely safe. This is the consultation. And to me, in everything we do, whether you're medically qualified people, doctor, dentist, nurse, whatever, this is the most important aspect of anything you will do. So I don't apologize for spending time on this. And as well as providing individual specific treatments to our patients, and we have to have aims and expectations of the patient accurately identified and met, and we have to have an honest and realistic expectation, ourselves and the patient. So this is just part of the consultation process. And I call this is the intercommunicating circle. I do call it the circle of Brian, but I thought I'd better not for this. And we can see in the middle, there's the botulinum toxin and dermal fillers. And this is what everybody jumps into. But unless you understand everything round the outside, you cannot possibly provide the best and appropriate treatment by just jumping in to the middle. And we've just mentioned anatomy, lifestyle, culture. When we treat different cultures, let's just think of people, let's just say a country, Japan. They have different facial features to what we do. How would you treat that person? What would they want? Smoking, we've mentioned. Well-being, obviously people's medical history. Can you treat them or can't you because of medical conditions? Skincare, the teeth. How important are the teeth when we provide these treatments? Very important. And that's why dentists are fantastically placed to provide the treatment, as well as being highly skilled and intelligent medical professionals, which you all are. Sleep, nutrition, exercise, psychology, so important. So important, especially for non-surgical facial aesthetics, as well as your dentistry as well. And we've mentioned before the sun, and you can see there how important the outside is. And we'll touch on a little bit of some of those. So what's the first thing you do in a consultation? You smile. You smile. Do you know what? You're 90% there already. You smile. And do you know what? You are listening to the person that made the worst dentures in the history of dentistry. I made them. And the patient went away happy. And I couldn't give him his money back, and I couldn't remake them. He didn't want them. He was delighted with the worst dentures in the history of dentistry, which I made. And there could have only been one reason, that I'd won him over. And empathic listening. Most people listen with the intent to reply. When another person speaks, we're usually listening at one of 4 levels. Ignoring. So you're probably doing one of these 4 levels now to me. You're ignoring, you're pretending, you're selective listening, or maybe attentive listening. But when you see your patients, this is what you need. And very few of us ever practice the highest form of listening, empathic listening. And the other important part of your consultation is that, I'm sure you all are aware and know about this, of course, only 10% of our communication is represented by words we say, another 30% by sounds, but 60% by body language. And you could say that there's an ABC of consultation. This was actually by a very eminent surgeon, and he gave a very famous talk, and he called it the ABC. I slightly, not disagree with him, but the first word he used was attentive, for attentive listening. I would substitute empathic for that. The B is body language, and the C is candor. Candor, always being open and honest with your patients. And the caring principle, so vital, because people do not know how much you care, how much you know. You could be the best, cleverest dentist in the world, do the most unbelievable treatments, but guess what? They won't care how much you know until they know how much you care. And what word is missing from the world? In fact, actually, during the COVID situation, it's come back quite a lot. But the word is care, because people don't care. I think people are realizing now how much important caring is. So we come on to botulinum toxin. What is it? Well, It's a neurotoxic protein. It's secreted anaerobically by the bacterium Clostridium botulinum. It's found commonly in the soil. It causes botulism, a rare but serious paralytic illness. And these symptoms were first described by Kerner as sausage poisoning. People were coming out of this eatery and becoming very ill. And Botox, botulus, is Latin for sausage. Now, of course, when you treat your patients, you do not say, I'm going to treat you with a sausage poison, which is going to paralyze your muscles, because you won't have many patients. What you can say is, I'm going to treat you with a very kind protein, which is going to relax your muscles, and they'll go, oh, I'll have some of that. And what happens when you get botulism? Well, you get double vision, diplopia, ptosis, you get drooping, reduced salivary and lacrimal secretion, you get difficulty in swallowing and speaking. I'm just going to see if I can move this box out of the way. No, I can't. Difficulties in swallowing and speaking, and muscle weakness leading to extensive muscle paralysis. Now, before you think, oh my goodness, I'm not going to do this, he said it was safe. Well, sorry, we've frozen. Stuart, we had this problem last time where it freezes. People, I'm going to have to come out of it, unshare it, and then come back in again.
Yeah, I think it's down to the internet. I can't really do too much about it.
But could you move that black box away where it's got 8 people have entered the waiting room? Do you mind moving that away for me, if possible?
Yeah, I'll try. I don't know why that. I think it only comes up for you. It doesn't. It doesn't. I don't think it comes up for any of them. It's just you as a co-host see it.
Oh, I've removed. Okay.
If I go to the waiting room, yeah.
I've done it. Don't worry. Right, people, we're moving on. I think it's working now. No, I've stopped, because when it stops, now it's got stop share.
Yeah. If you can't move the slide on, it's one of the problems with Zoom. What you have to do is right-click your mouse over it and actually physically click on next slide, and that activates the whole thing again. Yeah.
Right, so let me just do that. Let me go to this. I'm very sorry, people.
No, it's all right. It's one of the problems with Zoom. You have to just click on it, click the right one on your mouse, and then it'll say next slide.
Next, yeah. Right, here we go. So, botulinum toxin. So, as I was saying, I hope you're still here and you haven't left of the horrors of what's going to happen. Well, Botox, botulinum toxin, is used to save the lives of newborn babies. And it's used for various treatments. And this very clever doctor, Dr. Daniel, he used it for something called CHARGE syndrome. And it was quite a few years ago now. And he saved the lives of newborn babies. And it has a lot of other uses. It's like aspirin, a very underrated medicine drug. It's used for, as we know, people have migraine. It's used for other muscle problems. It's even used in neurology. So it has a plethora of uses, Botox. How does it work? Mechanism of action. We will just briefly go through so you can get some understanding. Our muscles contract after we release acetylcholine from the nerve ending, and this is released into the neuromuscular junction. So what happens is, if you want to move your arms, you're going to get acetylcholine across the neuromuscular junction and will move. Now, when we inject Botox, it binds into these receptors, and there's 2 chains, and the 2 chains separate, and the light chain becomes active. And what that does, it cleaves, which means it cuts one of the proteins, and there's something called the SNAP25 protein, which ensures that the acetylcholine can be taken across the junction. And what the Botox, botulinum toxin, does, it stops this happening. Therefore, there's no chemical release. Therefore, the muscles are prevented from moving because the SNAP25 protein is destroyed and it can't activate that muscle movement. Now, as I said right at the beginning, all the treatments that we use are reversible. So guess what? If your patient doesn't like the treatment, if they're not happy, they don't ever have to have it again because it will go back to where we were before. And due to our body just normally metabolizing itself, we get new sprouts. So those sprouts that are affected are metabolized out the body and new sprouts form with the unaffected acetylcholine, so the muscles go back to normal. Now, this takes place whether we use Botox or not. So we get metabolism constantly occurring around the body, of course. So these new sprouts occur in any event, but the ones that were there before were removed, and therefore we get our movement back. Products and brands. There are 3 botulinum toxin products out there. There is a new product, but it just introduced to the market, but we don't have it over here yet, and that's Nuceiva. But the main one, which you probably heard, the main ones are Botox. So from now on, instead of saying botulinum toxin, I'm going to say Botox because it's easier for me to talk that way. And that's manufactured by Allergan. These are all 3, they're all the top products. Dysport and Azzalure, they're identical, just that one comes in a 500 units, another 125. That's distributed by Galderma, manufactured by Ipsen. And then we have Xeomin Boccaccio. Xeomin is 100 units, Boccaccio is 50 units, and that's manufactured by Merck. The only difference is that I can just give you an analogy, whereas Botox and Xeomin and Boccaccio, although it's not exactly the same, you could say they're unleaded petrol. Dysport Azzalure is diesel, so it's different units. So you slightly mix it differently, but the results are similar. So how do we mix it? Well, Botox comes as a powder. They all come as a powder, all the botulinum toxins. So obviously you can't inject the powder. So we mix it with sterile, bacteriostatic, 0.9% sodium chloride for injection. And that's how we mix it up so we can inject it. So the Botox treatment areas. Now, when you start your training, the areas, we call this stage 1. It's not really foundation, because this is the most treatment you will ever do. This is the most treatment done, I think, throughout the world, in these upper face lines and wrinkles. And there's the forehead lines, which is on the bottom left there. There's the frown lines on the top, and the frown lines we treat what's called the glabellar region, glabellar, G-L-A-B-E-L-L-A, and I put an R on the end. And then we have the smiley crow's feet. So these are the upper face areas. These are what people mainly come in for and say they don't like. Sorry, everybody. And you have to understand, excuse me, as I said in the beginning, you must understand your anatomy. And it's the upper face, and I don't know if you can see with my little arrow there, the frontalis muscle is a very big, wide muscle, very strong muscle, and that elevates, and that's an elevator muscle. And then we have the muscles here, which are in the middle. Can't get my cursor to work. Yes. here in the glabella region, and these are the frowns, and then we have, yeah, this work, yes, sorry. And that, well, we can see round the eyes, sorry, the cursor's not working very well. And that is the orbicularis oculi muscle. So the orbicularis oculi muscle is a depressor, the frown lines are depressors, and the frontalis, the big forehead muscle, is an elevator. And we have to understand that, because otherwise we can't balance the muscles to get the desired effect. Now, when you come to do the more advanced treatments, we'll just mention a couple later on of functional movements, we'll be working more on the lower face as well, and we can raise the corners of the mouth, we can treat a dimpled chin, we can turn up the nose, we can even inject above the lip, we can do the platysma muscles on the neck, we can tweak eyebrows, give different eyebrow shapes. So there's a lot that we can do with the Botox treatments, but when you first start off, you'll start off with the upper face. And this just puts a little table for you. So we've got the frontalis, we've got the corrugator, and the procerus and depressor supercilii. Both those, or those three muscles, are the glabella region, and they're the frown line muscles, and the orbicularis oculi is it's a wide, flat muscle, and that's the crow's feet muscle. This is a patient of mine, and I just wanted to show you how we specifically mark up. We're very precise. The technique is the technique which I developed years ago. Probably everybody, or a lot of people copying now, but it's measuring and marking. So when you inject, you don't have to worry, and we use preloaded needles. So when you inject the patient, all you're focusing on is putting the needle in that point, because you've done all your assessing and measuring and marking beforehand, and it makes it most joyous and enjoyable to do, and the patient loves it as well, because it's how they feel that you're caring for them differently. Because lots of people are doing these treatments, and you need to be better and different. And what will show you a little techniques, and of course you'll develop your own, of how to be better and different. So this is obviously in a man. We tend not to put as many points in a female. A man who's got stronger muscle mass, we've got 2 rows there on the forehead. Some women don't even want treatments on the forehead. They're not that bothered. They can cover it with their hair. Obviously, I can't do that. This chap probably could. And then we can see the marked areas to inject on this particular patient in the frown area. And then this next slide shows you some of the crow's feet injection points. This was a patient of mine who came in. This was after one treatment. You can see the glabella and forehead region. Not a bad result, actually. What we didn't like is if you look on the bottom picture, where we've got a little bit of an uprising of the eyebrows, and there's a little trick there that we can do just to lower those. They'll lower it within a few days or so. So yeah, we can see we can have quite fascinating results. And this is a patient of mine for crow's feet. I boxed it because I just wanted you to see that it's not about taking all the lines and wrinkles away. Because when we smile, actually, the corners of our mouth go up and we get these little crow's feet. You don't want people to come in, and I don't know if you can see me, and you say, "Are you happy?" "Yeah, I'm happy." And you can't move at all. You need to move, you need to smile. If you take something away today, less is more. So all the treatments we do, less is more. You can always top up. You can always put more in. And that gradually builds you. Remember, you need to walk before you can run, and we'll teach you to walk before you can run. And this is me measuring up, showing how to do it. My lovely endodontic ruler. People say, people always have a very favourite instrument, don't they? And whatever they do, you endodontists out there and periodontists and restorative people, you have a favourite instrument. Well, guess what mine is? Mine's an endodontic ruler. And there it is, me marking and measuring before I do any treatment. Just shows you me injecting into the glabellar region, which is the frown region, injecting into the forehead area, and then injecting onto the crow's feet. So there are complications. There's always potential complications. And whenever we do a medical intervention, we have those. And obviously there's bruising, there's swelling, infection, you can have headache, eyelid ptosis, brow ptosis, which is drooping, brow repositioning, double vision, and facial muscle weakness. A lot of those are rare. Obviously you might get a little bit of bruising, a tiny bit of swelling. They're all transient in any event. And if you inject in the correct way, the correct technique, you'll avoid these, and we'll just talk about that a little bit, probably touch on that as well later. But you do have to understand, a large part is understanding how to treat and avoid complications, because we're as strong as our weakest link in everything we do, dentistry, medicine, nursing, and of course in the facial aesthetics. So how long does the treatment last? Well, it takes effect noticeably. People can say 2 to 5 days. Now, research has shown that one of the toxins, botulinum toxin, takes effect after about 12 hours and another one after about 48 hours. You never tell your patient that, because they will be looking in the mirror the next day going, it hasn't worked, why hasn't it worked? So I don't actually say 2 to 5 days. I say you might start seeing something between 7 to 10 days with a peak effect after 14 to 21 days. And how long does it last? Approximately 3 to 4 months or more. The more you have the treatments, we find that it might last a little longer because you're having the treatment. So I don't know if you can see my shirt here, if I'm creasing it like this by frowning all the time, it's going to crease more. If I stop it moving by putting Botox there, it's not going to crease as much. So if it starts coming back again, over time, it's going to have less creases. So the more treatment you have, the less creases that you'll have. So it might last longer. Just a point, people who exercise a lot, it will metabolize out the body quicker and it won't last as long. And you can see someone within about 2 to 3 weeks, and if they need, you never call it a top-up, but for this we'll call it a top-up. And if you need to put some more in just to maximize the effects of treatment, you can do so within a 2 to 3, maybe stretch it to 4-week period, but then you can't re-inject within 12 weeks. And the reason is because the muscle balance will be out of sync. So if you start putting more in the forehead and you haven't put any in this region here, and this wears off and this isn't, you get ptosis. So bruxism. So as well as aesthetic, we have functional uses, and especially for dentists, bruxism, people grinding their teeth, wearing their teeth, tooth surface loss, it's a big problem. And it affects more than 6 million people in the UK, and the severity of symptoms and frequency of grinding varies, and it can occur, as we know, in both children and adults. And when I treat patients for bruxism, I would do in conjunction with a dentist. I just don't get someone in and put Botox in them. They'd be referred by a dentist, or if they've just come in, I would say go to your dentist, because we can work together with maybe bite appliances, etc. So, sorry, this is an area into the masseter muscle. So right into the most prominent part of the masseter muscle, we can inject. Now, there are, I also inject into 3 points of the masseter muscle because I can change the shape of the face. Because when we grind, what we're doing, it's like doing weights, we're putting muscle on, and people get a squarer face by by clenching all the time. It's like doing bodybuilding on your face, and it gives a squarer look. And by putting Botox in certain positions, we can just give a little bit more curvature back to the face, and it's a fascinating treatment to do. Now, we wanted a model. We asked this handsome chap to come in and be a model for this, and this is for the gummy smile. And I put the muscles in on this slide just to let you understand that you do need to understand why you're injecting and where you're injecting. And you can see we're actually hitting three muscles there. And if you think, oh my goodness, that's very complicated, all these big words, if you think about it, it's all Latin. And if you divide it up, superioris is upper, levator is elevating, and labii is the lip. So it's the upper lip elevator muscle. And where it says alequi nasi, it's actually by the alar of the nose. So the muscle by the alar of the nose. So it's we're not so posh as we think we are. We move on to dermal fillers. Yep, we're fine for time. Where this is filling and volumizing. Now, cosmetic dermal fillers are injected into the skin. So we've been talking about muscles. Now, literally, most of or everything else with facial aesthetics is about the skin. Botox is the muscles, but literally everything else is about the skin. And we don't have to make these up because they come in pre-filled sterile syringes. And we take them out the sterile packing, and then we put a sterile needle on the end, and then we can inject. So hyaluronic acid, this is what I use. There are different types of dermal fillers. The one I use, and the only one I use, is reversible. And I use a hyaluronic acid type dermal filler. This is the most used worldwide, and it's a lovely dermal filler to use. It's got hydration because it's got hydrophilic properties, so very high water retention, and it's got a helicoidal structure, and it can entrap about 1,000 times its own weight in water. So actually what happens, it matures. So you do the treatment, and if you look about 3-4 weeks later, it matures, looks even better, and it affects the skin as well. And people say, oh yeah, look, my skin feels better as well. So it doesn't only fill, it also acts as a rejuvenating material. And it's viscoelastic. And as I just said before, we can improve the hydration and tonus of the skin. How do we get it? Well, it's biotechnological origin, and it's from non-pathogenic strains of the Streptococcus type of bacteria, and therefore it's non-animal and does not require a patch test. So hyaluronic acid in the body, 56% of hyaluronic acid is found in our skin. So what we do with hyaluronic acid, actually we're replacing a natural substance which the body's lost. And as I said, 56% of our hyaluronic acid is in our skin. It's also in other parts of our body, our connective tissues. If we didn't have hyaluronic acid, I'd be creaking probably if I'd lost all my hyaluronic acid as my oiling type of material in our joints. So the skin, we have to understand the skin. And this is the skin at 6 months, the skin at 30 years, and the skin at 90 years. And we lose an average of 6 to 10% of our skin thickness every 10 years. And the first signs of aging appear around early 30s. Well, actually, it's around about 27. So those of you out there You can put your hands up. How many of you are 27 and under? You're fine. The rest of you on the way out. I'll say we've had it. On the way down, on the way out. Finished. And we have loss of elasticity in tone as well. And this is what happens. We get from that lovely triangle to that isosceles trapezoid type of features. And it's like a balloon deflating. Look at that. And there's gravity as well pulling us down. It's a bit depressing, but help is at hand. First of all, we just look at the teeth and just at the aging process of how the teeth affect us. And obviously when we do the treatments, it's very important to know the person's dental state. We wouldn't want to do fillers of the lips if people are having orthodontic treatment. We also wouldn't want to do treatments if they've got lots of teeth missing and they're having implants placed. So we need to understand, these are just some examples of how we come up really trumps in understanding the facial features due to the dentition. And what happens to us as that horrible word, age? Well, we can see here that the angle of the mandible changes from about 95 degrees to 120 degrees. Becomes thinner and narrower. And the angle of the orbit, you can see that changes too. And if we look at the youthful face on the left, and then the aging face next to it, this shows our fat pads, how they diminish and how our muscle tone changes. And then if we look on the right-hand side pictures, we can see the skeleton. And looking on here, what happens to us? Well, our nasal aperture enlarges. Our orbits get bigger and sink back. Our jaw changes shape, as we said, it becomes narrower, becomes thinner. Our teeth wear down, our ears get bigger, and our nose turns down. Oh dear. And the skeletal changes occur in both men and women. However, many of these changes occurred earlier in females, were found to occur earlier in females around young and middle age, but in men, most changes occurred between middle and old age. And this was research from one of the journals of plastic and reconstructive surgery. Showing that it's important, as we said before, to know your anatomy. There's a lot going on with our arterial system, veins, and just a simplistic view of our nerves. So we do have to understand the anatomy to understand where we're injecting, how we're injecting, and how to avoid vessels and nerves as much as possible. Now, whereas there are 3 botulinum toxins out there, 3 Botoxes, there's over 100 fillers on the market. And it's a bit of a minefield. The ones that we use are all FDA approved. This is the Juvederm range here, and it just shows you the different types of fillers that are around. And one of the key differences is the concentration of hyaluronic acid and the degree of what we call cross-linking, because the products, if we just had them in the raw, they'd only last about 3 weeks. And I don't think our patients would be too happy coming back every 3 weeks to have treatment. I don't suppose that we'd mind so much. So they're cross-linked, and the degree of cross-linking, basically how thick they are as well. So if we think about the thickness, because they can go from very viscous, which would be for volumizing, if we want volume, down to quite watery, where we're using it for hydration and rejuvenation. And we would choose what grade of filler we would use for the effect that we wish to produce. These are the areas. Whereas when we start off with Botox, we're injecting on the upper face. With fillers, we look more to the lower face. So we would look, if you look to the nose areas and below, the nasolabial folds, which are the nose to lip folds, the marionette lines, which are down and round the side of the mouth. And then we can look at the lips and the lip volume and contours, and we can turn up the corners of the mouth. When we get a little bit more advanced, we can go into the mid-face, upper face, and we can volumize in these areas. Also around the face contours, the chin, and when we're doing more advanced treatments of the chin and also of the nose as well. I thought I'd put in the some of the different techniques. So there's what's called the multi-puncture technique, where you literally put multiple injections, usually for hydration when we're doing rejuvenation. Retrograde, where we insert the needle and we inject as we put it out. Sandwich, where we layer one on top of the other. A fan technique, where we move the needle around without taking it out. So we just have we have less injecting points, and then cross hatching, which builds, and we can make scaffolds. So if you just think of noughts and crosses, that sort of thing, usually round and underneath in the in the area around and underneath the lip, in the mouth area. I've been talking at the moment, up to now, about using needles for dermal fillers, but we can use cannulas as well. And cannulas can be used as an alternative to needles. They're flexible. They do provide a greater ability to fill the varying contours of the face with a reduced number of entry points. Now, some people take to cannulas and they love using them and only use cannulas. Other people just can't get on with them at all and they only use needles. And then there's people in the middle who use cannulas and needles for their treatments. And you can see that a cannula here, usually slightly thicker than a needle and longer. And you can get cannulas, and they can be bendy. You can get them up 1.5, 2 inches long. And on this particular cannula, you can see the actual aperture where the hyaluronic acid would be passed out through. The cannula is not actually right at the tip; it's on the side. And the cannulas are thought to displace blood vessels rather than lacerate them, so reduce bruising and edema, and create a more pleasant procedure with less downtime for the patient. And clinical experience has shown a decrease in bruising, bleeding, and patient discomfort during and after procedure using a cannula. Now, I do use cannulas, but I use a lot more needles, I must admit, and I tend not to get bruising or a lot of bruising. And I just think if you do less is more and you're very particular and you plan what you're doing, you can either use a needle or a cannula with the same level of success. And this is a patient of mine straight after treatment. I'm really sorry that the pictures aren't the same size, but it's not a bad result. And that was nasolabials using needle. So we come on to the lips. Lips are one of the most visible of all human organs, perhaps the most emotionally expressive part of the human body. So it's hardly surprising that it's become so popular. But why treat the lips? Well, as that horrible word age, the lip volume diminishes. We also get redistribution of volume. And while the vermilion border, which is this border on the lips, becomes less defined, and we get lines radiating as well from the perioral area into the lips, and we call that lipstick bleeding. And the nose to lip ratio also appears longer, which can be particularly aging. As we've said, the longer the nose turning down with age. So the injection points of the lips, we have the lip body, the Million border. I put the wet dry border. I tend not anymore to inject into the wet area or the wet dry border. And you can see where the Cupid's bow is and the philtral columns. And these are the injection points for the lips. So this is what happens to us. Again, as we age, we lose that eversion. We lose that prominence, that you could say sexiness of the lip features. And naturally full lips and thinner lips, well, thinner lips can be enhanced, but we need to treat them cautiously. We don't want to have rigidity, and we need to build them up gradually. So a lip treatment might not just be one appointment, nor might a normal face filler treatment, but specifically with the lips as well. Sometimes you need to get your patients back a couple of times or so, especially when they haven't got the lip volume and you're going to build them up. Now on these naturally fuller lips, they're more forgiving, so we can add more volume because there's a great amount of natural tissue. The tips, remember, we can't give someone what they don't already have. So if you've got a small balloon and a big balloon, you can't blow up the small balloon to the size of a big balloon. We're limited how much we can change the shape of the lips. And we also need to be cautious not to overfill a thin lip. And we need to choose the appropriate dermal filler for the appropriate lip treatment that we're going to provide. Not my cup of tea. She's obviously very happy with this. I wouldn't send my patients out looking like that, and if someone wanted to come in and have lip treatment like that, I would refuse to treat them. We don't know what her lips were like beforehand, so we can't really comment, but I leave you to have your own opinion. This is Hang. She ended up injecting cooking oil into her face. Not one of my patients, of course. Amazingly, she found a doctor who was willing to give her silicone. What's more, he then gave her a syringe and silicone of her own so she could self-inject. And when her supply of silicone ran out, she started injecting cooking oil into her face. And what she says now, look at her lovely little thing on the left there. She says she just wants her original face back. So one of the things that you have to avoid is BDD, body dysmorphic disorder, body dysmorphia. And anybody who you feel has got BDD, my recommendation would be do not treat them. That's in dentistry as well. Anybody coming in where the alarm bells goes, hold back, because you will never, ever satisfy them at all. So we do have to look at what can happen when we use dermal fillers. There's swelling, redness, bruising, some tenderness, can have necrosis, delayed onset nodules, persistent erythema, infection, biofilm. But again, if you treat people appropriately, you're appropriately trained, less is more. You understand the products you're using, you understand the anatomy, you understand the patient, then you will avoid these problems. Yes, you might get a little bit of bruising, redness, a little bit of swelling, but it's natural. Some tenderness, it's all natural. And one of the pointers for using hyaluronic acid is we have a get out clause. And the get out clause is Hyalase, hyaluronidase. So we can get rid of hyaluronic acid with Hyalase. So if we think we put too much in, or we've got a little lump, or we don't like, etc., we can use Hyalase to take it out, to get rid of it. Temporary versus semi-permanent, permanent. With temporary, hyaluronic acids, longevity 3 to 12 months, reduce risk of side effects, easy to correct, lovely to use, lovely material to use. And we can remove the product with the Hyalase, hyaluronidase. Disadvantage, advantage, disadvantage maybe for the patients, advantage for us, regular treatment required. With semi-permanent, permanent, longevity we can have 2 years plus, but there's an increased risk of side effects due to foreign body rejection. Difficult, if not impossible, to correct problems, and problems may occur years later. If people for any reason want permanent fillers, I refer to a colleague with a different expertise to myself to use those types of fillers. Rarely does any patient ever come into me and say, I want permanent fillers. They've usually had permanent fillers and they're having them taken out and they want to go back to temporary fillers. But that's another story, because you don't use temporary fillers where someone's got permanent fillers. Temporary ages with you, permanent doesn't. And she's got her lovely saucers underneath her bikini top there, and she's got her lovely lips. I do love this lady. I think she's fantastic. But some people might think, well, if you have permanent treatments when you're 25 and then when you're 80, would that look appropriate? Again, you can have your opinions on that. Men and women, still a higher percentage of women are having treatments. More men now are having treatments. These figures may have changed. I think it's creeping up. How many men are now more aware of aesthetic treatments? Wrinkle reduction injections, sometimes they might not be enough, and they can be an adjunct procedure. So we need to be knowledgeable about other cosmetic aesthetic procedures. So I'm just going to again run through, just mention this to you, as well as needing to understand all these different aspects in the circles around our botulinum toxin and dermal filler inner circle. If we look to the blue circle on the left, the other treatments, we also need to understand what other treatments can be used. Now, I'm going to go on to the medico-legal aspect soon. However, no, I'll tell you what, I'll mention it when we get to that section. So some of the other treatments also available: microdermabrasion, that's aluminium oxide. We know about this when we use it for our bridges and adhesive bridges, where we blast the metal aspects. It's really this is like exfoliating, so it acts like an exfoliator. We then have medical microneedling, absolutely fantastic treatment. When you get into your Botox and fillers, if there's one other treatment that you should definitely look at, it's this medical microneedling. Fantastic for rejuvenating, and there's other things that it's used for, especially scarring, acne scarring, things like this. And you can have the automated devices or the mechanical devices. Fantastic treatment. Peels, chemical peels, they have their place. Radio frequency, IPL and laser, and skin tightening, carboxytherapy. This is for improving skin elasticity. So they say the studies and encourage collagen repair. So it's like a rejuvenation treatment. PRP, I'm sure you all know about platelet-rich plasma, and it can be used in conjunction with dermal fillers or on its own to help with rejuvenation. Threading. The thread lift, it's a type of procedure where it's temporary sutures and they produce a visible lift in the skin. So instead of doing surgery, you could use this as an alternative, and literally you suspend the skin by stitching up portions of it. If we come on to the economics of a facial aesthetics practice, there's no large piece of capital equipment to buy. There's no monthly lease payment. There's no large inventory. There's no huge stocks. And it becomes a profitable business. Because when you start using botulinum toxin and dermal fillers, you've literally got in your surgeries all the equipment you need. Yes, you might need to buy the specific needles, but you have all the other sundries that are there that you would need. And what you would do, you examine your patient, then you book an appointment. You could then order your botulinum toxin, your Botox and dermal fillers. It's delivered from the suppliers literally by the next day. So your patient could come in then a few days later. You do the treatment, your patient pays you, but of course you've got a month to pay your supplier. So it's a very good cash flow as well for you. Regulations. A very big debating point at the moment, that whilst non-surgical cosmetic industry is almost entirely unregulated, it is an area that's under continual scrutiny. And at some point, regulation and common sense will prevail. And one would hope that these procedures will be exclusively carried out by medical professionals or appropriately qualified individuals. Until then, a growing number of patients are being influenced by the media to investigate the qualifications of their practitioner. And I do have this feeling that maybe qualifications might be something which people will have to show in the future as regulation maybe changes. But that's my personal view. And what does the GDC say? The GDC says you must only carry out a task or a type of treatment if you are appropriately trained, confident, and indemnified. Training can take many different forms. You must be sure that you have undertaken training which is appropriate for you and equips you with the appropriate knowledge and skills to perform a task safely. They love the word appropriate. You should only deliver treatment and care if you are confident that you've had the necessary training and are competent to do so. If you are not confident to provide treatment, you must refer the patient to an appropriately trained colleague. And I love this quote here. The supreme art of war, to subdue the enemy without fighting. And obviously, I don't mean we're going to fight with our patients, but the best way to deal with a complication or complaint is to avoid it altogether. How important? Contemporaneous record. So I put this in here. When I do my expert witness work, and unfortunately, or fortunately for me, but unfortunately for dentists, etc., I've got a lot of work on, and the records are one of the stumbling blocks in litigation. So make sure that you have contemporaneous records. You also need to have photographs, clinical photographs. Now, my insurance for aesthetics, it's mandatory for my policy that I do take pre-treatment photos. So if anybody turns around and says to you or says to me, I don't want any photos, then I can't treat them. And I politely say that I can't treat you. I've only ever had one person who said that, who actually was quite a famous person, but I promised them that it was literally going to be under the GDPR, and then they let me take the photos. So I'd like to come on to the relevant law, because this really will help with your risk management. And if you work within risk management, you can work happily, you can work intelligently. you can really enjoy what you're doing. This is not a treatment. These are not treatments that you should do in fear. These are not treatments you have to do. These are not treatments which patients have to have. They're not in pain, they're not dying, they're not ill. They've come in because they want you to look after them. And that's why it should be such a joy for you. And the relevant law is part is negligence and breach of duty. And this is the Bolam test, a famous test which you may have heard of. And it's in assessing whether care provided by clinical practitioners has been negligent. The court assesses whether a reasonably competent practitioner in a relevant field at the relevant time, faced with the same circumstances, would have acted in the same way. In other words, in order to show negligence, the claimant needs to establish through medical evidence that the treatment fell below a reasonable standard to be expected of a reasonably competent practitioner, in a relevant field at that time. And therefore, it will be a defence to an allegation of negligence to show that a body of reasonable, reputable practitioners in the particular field would have also treated the claimant in that way. And that's known as the Bolam test. Another case law is the Bolitho, and that case, in that case, the court held that the body of opinion must be capable of withstanding logical analysis. In other words, it's the risk-benefit ratio. So if there's going to be more risk of damage to the patient from the treatment when weighed against the benefit, therefore, negligence will be established, even if other people would have done it. So if you've got your car and there's loads of mud and you drive the car into mud and the car's going to get muddy and rusty, and lots of people will do that, would have done that, it doesn't mean it's the right thing to do, because there's more risk than benefit about driving your car into a load of mud and getting it dirty and wet, etc. So that's a very simple analogy. And then this has completely changed medico-legal law. And this was in 2015, and it's the Montgomery case. And what happens here is, in a move away from the reasonable doctor or dentist, it's moved to the reasonable patient as the new point of reference. And it's something called the new test of material risk. And the test of materiality is whether, in the circumstances of that particular case, a reasonable person in the patient's position would be likely to attach significance to the risk, or the clinician is or should reasonably be aware that the particular patient would be likely to attach significance to it. So put another way, it can be defined as a significant potential for harm that a reasonable person would want to consider when making a decision about undergoing a medical or surgical treatment. So what this means, and what I was going to say before, and I'm bringing it into this now, is that when you talk to people about treatment, you might just talk to them about Botox and fillers, and you might not have mentioned one of the treatments. If you use, say, for instance, fillers, and things go a little bit awry, the patient could turn around and say, well, hang on a minute, you never told me I could have, for instance, medical microneedling. You never told me what the benefits would have been of having medical microneedling, the benefits and risks. If you'd have told me about medical microneedling, I wouldn't have had those dermal fillers. I would have had the medical microneedling instead. So you can see from this how the onus has been put on the patient to tell us what they, or for us to put onto the patient all the information to make the patient understand what are the treatments. Now, I'm not sure how there's going to be any time to do any treatments, but this has to be done. And you have to give people all the options, which I'm sure you understand you need to do in dentistry, and it's the same in facial aesthetics. we also have to have causation. So to show that there's any negligence, there has to be pain and suffering. And that's necessary to show that the negligent acts or omissions directly resulted in the injury or materially contributed to it. So if I put a pair of slippers at the top of the stairs and you fell down, but nothing happened to you, you just got up, there'd be no negligence because nothing happened to you. But if you fell over my slippers from the top of the stairs or shoes and broke your ankle, then there's causation and therefore negligence can be established. So I just hope that's given you just a little outline of medico-legal aspects to be aware of. So to conclude, the single biggest killer in a business, practice killer, is perceived indifference. Patients need to feel significant and important. They need to feel that you care. People will forget what you said. People will forget what you did, but people will never forget how you made them feel. And you too can make the worst dentures in the history of dentistry. And when you've made them, you let me know. Educational, inspirational, rewarding. You must make sure that your training gives you the right educational. It's also inspirational. It should be fun and rewarding. And it's rewarding by being inspirational and educational, and obviously rewarding in your work aspect as well. And I'd like to finally finish with my little mantra here. Excellence. We all strive to get that excellence. Will we ever reach it? Will I ever? You might, but will I ever reach it? I don't know, but you strive to try and reach it. Profit. You have to have profit. Profit so you can reinvest in your business. You can reinvest in training. You can reinvest in education. You can reinvest in getting the best for your patients to give them the best treatments that they can have. And then, just as important, fun. So if you can have excellence, profit, and fun, I believe you've made it. So thank you very much indeed.